Welcome back to Healthwise. With us today is Dr. Ben Sabagian, and we were talking about GERDs. I think you have some slides for us, Doc, to look at and comment on.
Just to recap, just before the commercial, I'd like to go over, let's go to slide number 2. The symptoms of gastroesophageal reflux are primarily that of heartburn. You have reflux of acid that comes from the stomach into the esophagus, and basically people have as symptoms trouble with heartburn, substernal chest pain, and difficulties with swallowing. Either food will get caught in the mid-chest, just below the xiphoid, or it goes into the stomach. Next slide. Most people will have symptoms that they don't even really attribute to reflux or gastroesophageal reflux disease, like asthma, aspiration pneumonia, or chronic bronchitis. A lot of people have that recurrently and don't even realize that they're developing it, because when they go to sleep at night, they reflux and it causes them to aspirate, to have bronchospasm, or to have evidence of bronchial inflammation, which causes them to have chronic bronchitis. They'll take medications for it, but they never really resolve the symptoms, and they keep having them over and over again. That's something that should trigger you to think, maybe I have reflux. Other things such as chest pain, or regurgitation, or even dental erosion. Some people have really bad teeth or really bad halitosis, and which is basically bad breath, and it's from reflux. You can have hoarseness or laryngitis, sore throats. I see a lot of people who, a lot of times when they complain of heartburn or reflux, they'll have laryngitis associated with them, and they'll have it occasionally. They don't even know why they got it. They think that they're sick, or they have a virus or something of that nature. And they'll also have, of course, burning in the throat and mouth, and trouble with, as I said, pain in swallowing of food down the esophageal gullet. Next slide. As we discussed earlier, and I drew on the board, you have a valve that basically prevents your food from refluxing. And most of the problems with reflux is an anatomic problem of that valve, which is demonstrated on this slide here. The area that's circled is where the valve is. And what normally happens is when the stomach, which is the big area on the bottom, fills up, it swells, and pressure causes that valve to flap close on the esophagus. The esophagus is the structure demonstrated above the diaphragm. The diaphragm, or is basically that muscular structure between the stomach and the esophagus. Next slide. When you have abnormalities of that valve, as you can see in the picture to your left, you're going to have the valve that's normal and normal anatomy, and then to your right you're going to have dysfunctional valve, which is a valve, as you can see, it's flaccid, it has no tone to it, and when the stomach fills, instead of closing, it just lets the food and material come straight up, as if it was a plastic bubble, a plastic bottle. And so as a result, you can see very, very well there how a dysfunctional valve will cause you your problem, and how just taking medication for that won't solve the problem. Next slide. Typically, people will have reflux that's physiologic reflux. Sometimes they won't even know that they have it. They'll go to sleep, they'll have aspiration pneumonia, they'll have asthma, or they'll have laryngitis, or they'll have vocal cord problems. They won't even know that they reflux. Many times their ear, nose, and throat doctor will tell them that, or they'll have their primary care physicians won't make the connection between the two. When they develop symptomatic reflux, you'll have the heartburn and the pain, and that is someone who's actually progressed now from physiologic reflux to symptomatic reflux. Actually, their anatomy has failed them even further, and then eventually they'll get esophagitis, which is actual changes of the surface of the esophagus secondary to chronic reflux, and esophagitis can eventually lead to more complicated conditions such as Barrett's esophagus, or actually adenocarcinoma of the esophagus, which is a malignancy of the esophagus. So ultimately, if gastroesophageal reflux disease is not treated, you can actually develop, over a long period of time, many years, you can develop cancer of the esophagus. Wow. And the gastroesophageal junction, which is what we demonstrated on the board earlier. Okay. Next slide. Proton, as we had discussed earlier, proton pump inhibitors are not necessarily the ultimate solution. You can take them, Tagamet, Zantac, you can take those medications and they work well, and you can take them for 5 or 6 months, but if you continue to have recurrent heartburn, then you have to assume that your anatomy is not appropriate or correct, and that ultimately you're going to need to have this thing fixed. So basically, while taking Zantac and Tagamet is a good way of treating symptoms, it doesn't delay the ultimate issue at hand. It simply masks the symptoms, and you will continue to have anatomic failure.
Okay. So it's like a Band-Aid.
Right. It's a good Band-Aid, but it's not. It's losing in medicine today. It's lost its purpose with regard to the ultimate treatment. Right. Now, part of that is also because surgery for many years, surgery for reflux was such a it had associated morbidity, or it has associated problems in recovery. But as time has gone on now, we have multiple surgical methods for treating that. Could I have the next slide? This slide simply demonstrates that people who take Zantac, Tagamet, Pepcid, Prilosec, any of the medications for reflux will still have symptoms even during the nighttime, mostly about 70% of them, and will continue to have symptoms progressing over a long period of time. Next slide. And of course, with this, you know, you don't want to be taking these medications for the rest of your life. And with it, of course, you have a tremendous expense with the medications. Could I have the next slide? Basically, this slide simply shows the progression of reflux from being what we had discussed earlier, from being just physiologic to symptomatic. Treatments, you can treat reflux with lifestyle changes, but if that doesn't work, then you can take medication. Eventually, if medications are taken for an extended period of time, meaning more than 6 months to a year, then you might want to consider surgical treatment for this process in the form of either Nissen fundoplication or what's a new procedure that's out called TIF.
TIF. Okay. Doc, we're going to talk more about that, and we're going to get more into the slides and the videos when we come back from this message with our sponsors.
Great.